Hello, this is Luke Herbert, and with me today is Gabe Billiet. Gabe is a staff pharmacist at KSB Hospital, and I am also a pharmacist at KSB Hospital. And thank you, KSB Community Wellness, for putting this program together. And today, Gabe and we are going to share with you a little bit of information about diabetes and, more importantly, the importance of self-monitoring in diabetes. So with that, we'll move ahead. Gabe, your definition of diabetes?
Sure. Diabetes is a very broad and wide-reaching diagnosis. But what it basically refers to is a group of diseases that affect how your body processes or deals with glucose. Glucose is vital to our health. It is the important source of energy that our organs use, and most importantly, our brain uses. It's the brain's main source of fuel. Now, part of the problem with diabetes is that as our blood glucose level gets higher, our blood tends to get thicker, which can impact important nutrients and oxygen getting to the brain and to those various organs as well.
Thank you. And so we'll talk a little bit about the importance of blood glucose levels. And with diabetes, blood glucose tends to be too high often, and it creates problems. And so, Gabe, can you walk us through some of the risks and the hazards of not being able to control blood glucose in diabetes?
Oh, definitely. The higher the blood glucose, the greater the risk of damage occurring to various parts of the body. As you can see from this slide here, almost every single part of the body is negatively affected when our blood glucose gets too high. In our brain, it can lead to increased risk of stroke. It increases the risk for depression. In the eyes, increased risk of glaucoma, cataracts, even blindness in some cases. The heart, it leads to heart attacks and hardening of the vessels themselves, and so on. I mean, the kidneys can be damaged by it, which the kidneys are a very important organ to our health, getting rid of excess waste, from the body through the urine. It affects the nerves, so it can be very painful, and it just basically affects almost every part of the body itself.
So a lot of damage that can occur with uncontrolled diabetes or uncontrolled blood sugar, and all this stuff we really don't see or feel necessarily while it's happening. We start to see the consequence of that if we don't control our blood sugar later on, when the damage is really done and has largely occurred. So let's talk a little bit, like we said, about the risks of complications from diabetes.
Well, to lower our risk, there's three main things that we can do. We can control the blood glucose, we can control blood pressure, and we can control our cholesterol. Now, today we're going to focus on the blood glucose aspect of it. And part of the problem, like you mentioned before, is that when that blood glucose gets too high, that's when complications can occur. The problem is that we don't necessarily feel different as our blood glucose is getting higher and higher. And that's part of the issue there. And so the best way to control our blood sugar is to know what our blood sugar or our glucose level is.
Perfect. And so a lot of folks with diabetes, definitely if their blood sugar suddenly went up, they would feel symptoms of that hyperglycemia, but they kind of acclimate to that, correct, Gabe? They, with time, they feel kind of normal with high blood sugar. And so they don't know their blood sugar is out of whack. And so to your point, having a meter, watching your blood sugar results and paying attention to that is critical.
Now, we monitor by three main ways. As you mentioned before, a meter is probably the most common one that we're familiar with. We call that blood glucose monitoring, or BGM. They used to call it SBGM, but they decided to shorten it by a little bit and just kind of differentiates or kind of separates it away from the other types a little bit more, as well. That blood glucose monitoring takes a single kind of snapshot. It looks at a single moment in time and kind of gives us a reading off that home meter. Now, This can be limited by, the amount of times that people are willing to poke their fingers. But the important thing is that it's something that we can do at home, on our own. And one of our most important factors we can do to kind of control, diabetes is this factor. There's other newer technologies that have come out. Continuous glucose monitoring in the last 10 years has made huge strides to becoming more accessible for a broader population. And that gives us a lot more, data points throughout the day, a lot more levels that we can then check. And then the final way that we kind of monitor blood glucose is through the doctor's office. A lot of times they'll order what we call an A1C. That's a indirect kind of measure of our blood glucose over the last 3 months or so. A little bit more weighted towards the more recent past, but it gives us a little bit of an average, over those last 3 months or so. It's what most of the studies have been based off of in helping to reduce complications. Tends to be the lower the A1C, the better the overall health of the individual. But the problem with that is that that's just a very occasional test that the doctor will order, for us. It's not something that really we have a whole lot of control over. It's still important to know it, but it really doesn't give us an indication of patients going too high or too low. It's just that average reading.
Sure. So A1C, I guess, if you will, is kind of a 3-month summary, I guess, of about where someone's blood sugar is at, but it doesn't really tell us, maybe when our blood sugar is high relative to our meals and when our blood sugar is low, and it doesn't tell us how much we're swinging back and forth. But it gives the provider or your physician kind of a overall picture of about how you're doing compared to, maybe last time they were in the office or you were in the office.
Mm-hmm. And we'll talk a little bit more about that in another slide or two. So I guess, Luke, what should our blood glucose levels be? There's always a question that, we get a lot.
Sure, yeah, and these give you some ranges here. For a normal, in blue, relative to, somebody who has a diagnosis with diabetes and what we target in that scenario. So normal, our body normally keeps pretty tight control over our blood sugar with fasting or before meal sugars in the 70 to 100 range. Somebody with diabetes, we might let that acceptable range be 80 to 130 because we don't really want to risk hypoglycemia. Mm-hmm. And so we're not going to overtreat diabetes to the point where we risk having a patient's blood sugar be too low. And then there's also ranges here, of course, for like 2 hours after a meal. So, where does your blood sugar go after you take in sugars and carbohydrates? And then again, here on the bottom, the average A1C that we target for diabetes and what normal looks like.
Okay. One thing that I know that we've talked about in the past too is that everybody's range can kind of vary a little bit too. And so sometimes your doctor may go off of these readings and base your goals on this. Sometimes they might want a little bit tighter control. Sometimes they want to make it a little bit looser, like you said, to help prevent some of those low blood sugar or hypoglycemic events. Bottom line, I guess, is that we want to stress, talk with your health provider and make sure that you and your prescriber are both on the same page for what your goals should look like. We want to be realistic, with that, as well.
So certainly some folks are more at risk of hypoglycemia events where your blood sugar gets too low. And so in those patients, a physician may target a little bit safer range, a little bit higher range. Is that correct, Gabe?
That is correct.
Yeah, perfect.
All right. Now, this slide here, this kind of shows part of the problem with that A1C reading. Like we said before, it's just that broad average. Our goal for the American Diabetes Association, their guideline says that we want an A1C of less than 7. That means on average, the patient is going to have a blood glucose of about 154. Now, in reality, that means that they have a range somewhere between about 123 to 185. So a very broad range, that it could be, in there. I think we've got some slides on the next one here that kind of shows a little bit of a problem, with just using just the A1C as our guideline. On this slide here, we've got 3 different patients that all have the same A1C of 7. Now, each person is an individual, and each person has their own profile of blood glucose history with it. On person number 1, they have a large history of going too high and too low, both which could be potentially dangerous, increase the risk for complications. If your blood sugar goes too low, that hypoglycemia can cause confusion, poor decision making, dizziness, and if it goes too low, even unconsciousness. And then, as we talked about before, if it goes too high, that increases that risk of complications as that blood thickens up from that extra sugar, in there. Person number 2 has more of a moderate profile, still a little bit of a high, but much greater time within the range that we call time in range, or TIR, if you like abbreviations. And that TIR, or time in range, is kind of that optimum window of where we would like to see the patients at. As you talked about before, that kind of expected or normal range, right there. But person number 2 still is having quite a few high numbers, as well. And then we have person number 3, which is that ideal diabetic patient, which is very rare, that has 100% of their time is in that range that we wanted to go with.
And to just kind of tie back and circle back and summarize why this is important, the amount of time that a diabetic patient spends with high blood sugar over months and years kind of contributes to those complications that we talked about early on. And so we just want to minimize that without taking the risk or increasing the risk of hypoglycemia or low blood sugar. So we want to use this information and blood sugar data to find the right, therapies, and oftentimes insulin, sometimes oral therapies, to stay in range as much as possible, avoid lows, and avoid any as much time as we can with hyperglycemia and high blood sugar.
Definitely. So now, along with the A1C, which we talked about is a kind of a nice starting place from the doctor's perspective, comes into the importance of that self-monitoring, that home blood glucose testing. Here is an example of what we call structured checking profiles. And basically what that means is that a patient is given certain times of the day to check that blood glucose and to kind of see how it's doing. The first one is paired checking, where what we do is we check before a meal and then after a meal. And then we have the 7-point profile, which we're checking all the various data points, kind of throughout the day. And then last but not least, we have the staggered profile, which again is focusing on meals, but then it varies which meals, are then addressed.
Perfect. So somebody might want to just concentrate on lunch for a week or breakfast for a week. If they're trying to dial those numbers in and get those numbers right, depending on what they ate on a given day, and if their diet varies for a given meal through the week a little bit. And certainly consistency is critical to help and understand and keep your blood sugar at a consistent level and kind of matched up well with your insulin doses or your medication dosages.
Right.
Whereas the other, the 7-point profile might give you a chance to, look for a couple days, at all different points through the day and how you're doing and how your blood sugar varies throughout the 24-hour cycle.
Every diabetic patient is an individual. And so what this home blood glucose monitoring does for the patient is it gives them the tools and the information to make changes, in their lifestyle, in their activities, in their food intake. It just gives them that basis that they can then take control, of diabetes itself.
And how important is keeping a diary or a record of all this, and also, what kind of exercise you have going on through a day while you're doing these measurements, and what kind of or changes in your diet are occurring while you're keeping these measurements. Is it important to keep all that on a record to take with you to your provider?
I'm definitely a believer in that. The more data points or the more information the doctor has, the better the doctor can help you, manage your diabetes. Again, diabetes comes down to a partnership between the patient and their prescriber. And it's important to have that information to set good goals and realistic goals, with that. So a lot of the modern meters nowadays have, the ability to kind of track your levels and your readings, but I don't think it's a replacement for the good old-fashioned logbook, where we can make notes that, I had a tuna fish sandwich for lunch and I walked an extra mile this morning. Those are all really key points of information to help you figure out what's going to have the best effect or the worst effect on, on your control.
Perfect. Thank you. So just some information about taking blood glucoses in different times of the day.
Mm-hmm. Yep. The first one is the fasting blood glucose test. This helps show the effect of the previous evening's medication. That way, you can kind of gauge, or the doctor can gauge, how effective that medication is. It kind of lets you know what your baseline is going into the day. If you're going to be behind all day long, or if you're ahead of the game, it gives us a good, good feel for that. And then, as we had talked about before, the pre-meal and after meals, they allow us to kind of fine tune in and realize what our choices, what effect those choices have, on that blood glucose reading. Having, a bunch of starches, carbohydrates for lunch, or foods that we may not even consider as being possible to raise our blood glucose, we can then see what effect those might have, on there. And then, of course, you've got the bedtime one, which will help kind of figure out, how we're ending the day, going into our sleep cycle too. And then probably the one that I don't think gets mentioned enough is the 2 a.m. test. I tossed this one in there just because if a diabetic wakes up sweating, in the middle of the night, confused, that's a really good indicator to test your blood sugar and just see what it's going, especially if you're on insulin. Sometimes various insulin dosages, may have a longer effect to them, and they may be hitting at a time that we're not expecting them to. So that's an important test to kind of keep in mind, especially if we're trying to figure out, what direction our control is going.
Perfect. Thank you. And so why is it important to monitor your blood glucose?
Well, as we've stressed before and before, more information. Basically, it's just that whole cycle. More information equals better control. Better control equals less complications. Less complications equal a healthier you. A healthier you in general is a happier you. So the more that we know, the more we can act on that knowledge. We can realize what's making our numbers go up or go down. When we eat different foods, how is that affecting? With that home blood glucose monitoring, we can get a direct feedback to it. We're not having to wait till we see the doctor. We're not having, to wait on lab results. We get a direct feedback right after, a meal. And so we can see those direct consequences, in there.
Perfect. And so, thank you, Gabe. And, that'd be a good time to stress too, to utilize your pharmacist as a resource to help you with, managing your blood sugars or at least understanding the equipment and the monitor that you have, and helping you make the best use of that, I guess, to, keep a record so that you can take that to your provider and keep fine tuning what you're eating and your exercise and your medications and your insulin to get your blood sugar dialed into as much as we can into a normal range, healthy range.
Mm-hmm.
So thanks, Gabe, for putting this together and for your time and expertise.
Well, thanks for having us. So
thank KSB Community Wellness as well for having us today.
And if anybody has any questions, please put them into the comments. We'll be monitoring the comments after this presentation, and we'll be happy to answer them to the best of our ability. And if there's any topics that you'd like to see addressed by these two pharmacists or any pharmacists on our team in the future, please let us know also in the comments.
Very good. Thank you, Gabe. Thanks, everyone. Have a good rest of your day.